Welcome to Brotherhood of Healing, the podcast devoted to supporting veterans in health, resources, and in life after the uniform. Here we share inspiring stories, valuable information, practical advice to help our veterans thrive beyond their service. Whether you're seeking guidance, community, or simply want to hear from those who understand your journey, you're in the right place. Thank you for your service and welcome to the Brotherhood of Healing. Tying on target now. Welcome back for another segment on Brotherhood of Healing. Today, we are talking about psychedelic medications and substances. But just a FYI, we also have a segment coming up with a Marine Corps veteran who is a lender in the greater Phoenix area. They're nationwide, but his company is the one who does it over here in the Valley. Really interesting stuff. I really strongly encourage you guys to listen to that segment, especially for those of you who are interested in purchasing a home at some point, using the VA system, VA loans, what have you. That is, he offers quite a bit of shortcuts and pearls for that. So that's coming up here shortly. But today, we're going to talk about psychedelics and how they've evolved in our system. Now, as you may or may not know, I am a physician assistant by profession. I specialize in orthopedics and pain management, as well as I have a doctorate in psychiatry. And in psychiatry, a lot of the magazines and a lot of the CMEs that we're doing, as well as new evidence-based stuff, there's a lot of articles about psychotropic medications, as well as psychedelic medications and what that does for people. In the old days, they would prescribe these things readily. And somehow the pill makers and the big government and what have you, they decide, well, if we can't make money on this, let's make it just difficult for people to get. And very little research was done after that. But up to a certain point, the research was really good for folks who have been, especially trauma victims. And this is germane to veterans who, of course, experience trauma in combat or otherwise, but any type of trauma, really. And the story I like to tell is about a guy who I know who was regular Army guy who suffered quite a bit of trauma in his time in the military. Got out, became like a hedge fund guy. He made lots and lots of money. Is doing great. Life is good. And like life happens, PTSD, like a lot of things, rears its ugly head at the most inopportune time. I'll talk a little bit more about that later. But he was going through a very difficult period, losing his son a few years back, and he never, and with that kind of trauma, it triggers other things, right? So he became quite depressed and anxious, and had a lot of things going on. I as a father myself, I never want to know what that's like. But he started going and to one of his to his provider, and he was getting ketamine infusions done. And I had not seen him for a while, and he had invited me and my wife over to his place for a friendsgiving, kind of a dinner slash get together, bunch of friends and such. And I was marveled by the changes in him. I saw a guy who was rarely smiled to a guy that's smiling and laughing and joking around, and I pull his wife aside and I go, "What happened to the angry guy?" She goes, he's been getting ketamine treatments, and somehow it's working beautifully for him. It's night and day. I have my husband back. It's awesome. So that's just one of these medications. Now, to understand these psychedelics, right, you have to understand what happens. The best way I can explain it is that there is a phenomenon that occurs when you are in an altered mental state that allows for your body to produce and grow new neurons and new ways of communicating. Okay, imagine yourself on a bicycle on a one lane highway, and um, and that's how you process pain. That's how you process anger. That's how you process everything. So the communication is slow, and it's not very effective. Now, all of a sudden, you are in a state of separation of body and mind, kind of like when you are on ketamine. And what happens then? The phenomenon occurs. There's neuroplasticity, which means that the neurons, are new neurons, are forming. And now, instead of riding a bicycle on a one lane highway, you are in a Ferrari in a six-lane highway. So that anything that you process pain, uh, depression, anxiety, fear, everything is processed very, very differently. What before would make you super anxious, now you're like, so, yeah, so what? So that is the kind of the thing that and the evidence is really good, not just from the perspective of my friend, but I've seen quite a few articles on the subject. So the days of just doing talk therapy, which is very important, is becoming now in conjunction with EMDR, and prolonged exposure and things like that. But it also, now we're inculcating ketamine into the mix to really kind of helps with the depression and anxiety that is organic to PTSD, that form that you get these other conditions along with PTSD, right? God forbid that we have something out there that really works for people, that we get a lot of shutdown and a lot of difficulty to try to be able to utilize this as a new modality, right? So, and with reason, I think safety is super important with this, but they require you to have understanding of the medication that you're using, that you have a board certified anesthesiologist in your staff that can monitor, and things like that, to make sure that the medication that you're providing to your patients is something that is well controlled, and is because it is a controlled substance, and is also it's something that is you have to keep great accountability of, as well as monitoring your patients carefully. But that's just on that end. I know that there are other medications out there, and by medications, I really talk about things like, not necessarily mushroom, but substances. I suppose, things like mushrooms, and of course LSD and MDMA, and to a certain extent others. But and there's so much research being done right now on all these, and finding that people are actually improving with these type of substances. So more to come with that, as I continue to see more and more of these topics being not only discussed by professionals in my field, but also by patients who come to me and they'll ask me, "Hey, what about this?" And frankly, it's not something that I particularly do, but I think that it'd be a really good idea to maybe inculcate that in our practice. But again, making it so difficult for anybody to just be able to administer these things, right? But there's still a lot of research needs to be done. Still, I know a lot of it was done in the '60s and so on. I don't know how germane that is to current state of things, but if I would talk to your primary care provider, and whoever your psychiatrist is, and if you're seeing a counselor, I would ask the counselor as well. And independently, you can look up online. Different places in town that do it, and these are all legitimate places. These are all clinics that dedicate themselves to just that. And I'm really talking about ketamine. And if especially if you're recalcitrant to improving with your pain levels, if your depression is really resistant to medications, if you're already on two or three antidepressants, and what have you, and other psychotropic medications, it might be well worth your while to at least check it out, or do the research yourself and find out if this is something that would really work well for you. So that's kind of like the topic today. I do think I'm really excited about how and where this is going. I hope the momentum keeps up and that we are able to get a better understanding of how these medications work. And I keep saying medications, but I really mean substances because they're not quite medicine. Um, and and see how well we can help folks with this type of modality. Um, but like all things, I believe we will grow much older before we grow any smarter. So one of the questions I get a lot is from our patients. They want to know if once they're on ketamine, do they have to take it for life? And it's such a great question because what we found is that people do really well, and just like all things, we talked a little bit earlier about the trauma, right? Trauma has a way, life has a way of just knocking down some of these receptors, right? So now you're operating on very limited communication flow, right? So once you're on ketamine, and a lot of these new neurons and synapses are starting to fire correctly and the way it's supposed to, yes, you get quite a bit of reprieve. Is this something that you have to do for the rest of your life? It depends. It really depends because life has a way of doing these things, and you may need a tune-up every once in a while, every 6 months to a year. You may need to go back for a quick, um, just like a maintenance thing. And most people kind of feel most people know when things are starting to go south again, and they want to maybe get a little tune up, and that usually buys them a lot more time. So, in answer to answer, short answer is yes. In depending on what's happening in your life, if your life is hunky dory and nothing's going on, and there's no trauma, there's no new onset of things, then chances are that you should be okay. But a lot of people will seek out maybe to redo a series at some point in their life. But if you are interested in this sort of modality, again, you can look it up on your in your local area. They may have some a provider there that does this that is legitimate and knows how to dose it correctly, and you might get great benefit, especially if you're suffering from like all the elements I've mentioned before. With that being said, this kind of concludes the segment of my show today. Just want to talk very briefly about psychedelics and how that has affected healthcare, and there'll be more to come on this topic uh, later on segments on later down the road. Thank you. Bye bye. Thank you for tuning in to Brotherhood of Healing. If you're hearing this message, you've listened to the entire episode, and for that we want to thank you from the bottom of our hearts. If you enjoyed today's episode, please take a moment and leave us a review on Spotify or Apple Podcasts. Your feedback helps us grow and bring you even better content. Don't forget to hit the subscribe button so you never miss an episode. Until next time, keep your powder dry and watch your six.